We're back with Dr. Msonthi Levine to answer your medical questions. This person asks, can a pulled muscle behind the shoulder blade cause your elbow and neck to hurt?
Yeah, absolutely. I think that depending on the injury, it can. X-rays a lot of times can figure that out. A lot of times we'll start with anti-inflammatory medications. Pain can travel and be referred, so sometimes it's really hard to tell what it is, but typically we can figure it out.
Okay. This person has had their blood work done and their potassium level is low. Will losing weight make that happen?
Not at all. I don't think so. A lot of times it's from medication, or sometimes if you're dehydrated, that can happen. Sometimes there are metabolic abnormalities of the kidney that create that. A lot of times just potassium replacement can figure that out. Bananas, no. Potassium tablets normally help that. So typically weight loss, no.
Okay. This person shaved their eyebrows when they were 15. She's now 53. She was just wondering why they never grew back.
Have no clue. I guess my question would be, why did she shave them off at the age of 15? But I don't know. There are some metabolic problems that don't allow the hair to grow. As long as the hair follicle is healthy, and once the metabolic problem completes, then typically the hair will grow back. So maybe something wrong with the hair follicle. Sometimes connective tissue diseases can cause that. Trauma to the skin can cause that. So just a whole host of things.
Okay. What are some natural ways to help control high blood pressure?
Natural would be diet.
Exercise?
Yes. Eating healthy food, that's real natural. Trying to limit the foods that have a lot of starch and calories. That's never going to change. We need to get more on board as a society and a culture when it comes to that, because that is the root cause of a lot of our blood pressure issues. Is we're just overweight, we're not exercising, we're eating all the wrong foods. So yes, that's the natural way.
That's the only natural way, huh?
Yes.
Okay. What over-the-counter medicines do you prefer to get rid of clogged ears for sinuses?
The antihistamines work pretty well. A lot of the cold and flu medications are pretty good. Just have to watch for if you have high blood pressure, but the packages and the labeling is pretty good about that. And those medicines work pretty well. Mucinex seems to be very popular with the patients. So I don't have a problem starting something over the counter, because a lot of times it does work. You don't have to go to the doctor's office, pay a copay, etc. So just try them.
Okay. Is it a good idea to call your doctor to get a prescription refilled?
Yes, it is. I mean, some doctors like to see you in the office, like myself. I like to see my patients in the office. A lot of patients are very busy. They don't want to go into the office. They have a lot of medical problems. We have a lot of checking with them. So it just depends on how long they've been seen, what the medical problems are. Sometimes we do that, and sometimes offices will do that as well.
Okay. A 50-year-old woman with HPV from her pap smear is just now getting in to see her gynecologist. How quickly can this become cancer?
Typically, I don't know, to be honest with you. It's a risk factor to develop cancer. That doesn't mean they're going to develop cancer. It's just a risk factor. Certainly talk to the gynecologist about being immunized against the HPV virus. Certainly if your pap smear has been normal, you're not having bleeding, probably no cancer for now. So it's just a risk factor for cancer. So we just want people to be aware of that and get their pap smears.
All right. As always, Dr. Levine, we appreciate you taking the time
Yes,
to stop by and answer all of our questions.
All right.
And as always, you can visit our website and see the answers to these and other medical questions posted online. And if you'd like to have Dr. Levine answer your medical question, you can always mail us at the address listed on your screen. Fax us 892-7305. Email us at laf@kfdm.com, or you can post those questions every Monday on our KFDM News Facebook page.